Good afternoon, everyone. I'm Dr. Mariam Yasmin. I'm an international medical graduate and currently I'm pursuing Canadian medical licensing. As we all know that October is a breast cancer awareness month, so One Muslim Women has decided to play their role to create awareness in our community about breast cancer. I'm thankful to them that they have given me this opportunity to talk on this very important topic. I would also like to thank all the participants who are joining us for today's session. Before moving on to the main topic, I would like to make an announcement regarding a walk for breast cancer awareness, which will be organized for One Muslim Women. And you can get the details from their social media page. So talking about breast cancer is one of the most common cancer worldwide. In Canada, it is second most common cancer, and in women, of course, it's the most important and most common cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Statistics shows that in 2020, 27,400 women have been diagnosed with breast cancer. And 83% of cases occur in women whose age was more than 50 years. So this statistic shows that how important it is for us as a woman to have awareness about breast cancer. Before talking about the abnormal changes in the breast that can be a manifestation of breast cancer, I would like to discuss the normal breast and the normal changes in breast with aging. When women are young and they are menstruating, few days before their periods, the milk producing activity become active in some tissues. As a result, women's breast may become larger or feel lumpy and tender, especially near their armpits. This is a normal change. Similarly, after the menopause, the average age of menopause is 51 years. Activity in milk producing tissue stops. Breast may change size, feel softer, less firm, and not so lumpy. These are the normal changes in breast with aging, and we should be aware of it. Knowing your own breasts and being aware of what changes are normal for you is called breast awareness. We all can be breast aware by looking at the breast, feeling them in any way that is best for us. For example, you can do that in the bath, shower, or when dressing. Do this regularly, for example, monthly. Medical professionals no longer recommend a set way to check your breasts. It is important to feel all parts of your breasts, including your nipples and in and around your armpits. Breast awareness means knowing your own breasts and being aware of what changes are normal for you. ये बहुत अहम है कि हम सब लोगों को पता होना चाहिए एज अ वुमेन कि हमारे लिए क्या नॉर्मल है और क्या नॉर्मल चेंजेस हमारे ब्रेस्ट में आती हैं विद द एजिंग और बिफोर पीरियड्स बिकॉज देन ही हम आइडेंटिफाई कर सकेंगे कि क्या एबनॉर्मल हो रहा है और अगर आप कोई भी एबनॉर्मल चेंज अपने ब्रेस्ट में महसूस करें या देखें तो ये वो टाइम है जब आपको अपने डॉक्टर से फौरन रिजू करना है ताकि वो उसका मुआयना कर सके और इन्वेस्टिगेट कर सके। अब ये कौन सी एबनॉर्मल चेंजेस हैं जिनके बारे में हमें केयरफुल होना है? What changes should we look for? And what changes are considered as abnormal changes in the breast? If there is a change in size or outline of either breast, especially those caused by arm movement, any puckering, dimpling, or redness of the skin, or veins that stand out more than usual, any lumps or thickness in either breast that feels different from the other breast, any swelling or lumps under your armpit and around your collarbone. If you feel any pain or discomfort in any part of the either breast or in your armpit, particularly if this pain is new and persistent, any change in nipple, a nipple that has become pulled in, changed shape, or shows signs of any discharge, bleeding, rash, or crusty, flaky skin, these all are abnormal changes. Does that mean that it's a breast cancer? Not necessarily. But can you decide that it's a breast cancer or it is a non-cancerous condition? Certainly not. You have to consult your family doctor Your family doctor will examine you and do mammogram or ultrasound, whatever is required, and then the results of those tests will shows that whether it is a cancerous condition or it is a non-cancerous condition. अगर आपको अपने ब्रेस्ट में कोई भी एबनॉर्मल चेंज देखें या उसको महसूस करें तो फौरन अपने डॉक्टर से रुजू करें. आपका डॉक्टर आपका मुआयना करेगा और इन्वेस्टिगेशन करेगा, और उन इन्वेस्टिगेशन के रिजल्ट्स पे ही ये पता चल सकता है कि ये कैंसरस कंडीशन है या नॉन कैंसरस कंडीशन है. बहुत सारी नॉन कैंसरस कंडीशंस भी हैं जो कि इसी तरह से प्रेजेंट करती हैं, बट हम इस चीज का डिसाइड नहीं कर सकते. सो इन्वेस्टिगेशन बहुत अहम है. Remember 5-point code. Know what is normal for you. Know what changes to look and feel for. Look and feel. Report any change to your family doctor immediately. Attend for breast screening from the age of 50. Breast screening is a very important topic, and I will discuss it in detail later in discussion. Now, what is breast cancer? Breast cancer starts when cells in the breast begin to grow in an uncontrolled way and build up to form a lump, also known as a tumor. As the cancer grows, cells can spread to the other part of the body, and this can be life-threatening. There are certain risk factors that can contribute to breast cancer, and we divide these risk factors into modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are those risk factors for which we can take measure and control them. Modifiable risk factors include hormone exposure, alcohol intake, overweight and obesity, and physical inactivity. We can control them. Try not to use hormone for a very long period of time. If you are using alcohol, we can cut down alcohol. Being obese and overweight is also a risk factor. So healthy lifestyle can be beneficial in this case, and we can avoid breast cancer by staying healthy and physically active. There are many other risk factors. I have just mentioned the more important one. Now, moving on to the non-modifiable risk factors. These are the risk factors for which we cannot take measures. The most important risk factor in breast cancer is aging. We cannot stop aging. It's a natural process. And unfortunately, it is one of the biggest risk factor of breast cancer. 83% of breast cancer develop in women when they are above 50 years of age. Positive family history is also a very important risk factor for breast cancer. If you have a family history of ovarian cancer, or if you have a family history of breast cancer, unfortunately, you are at a very high risk to develop breast cancer. BRCA gene mutation, that is your genetics, that cannot be changed. Again, unfortunately, you have 25% more risk than the average woman to develop breast cancer. Late menopause is another risk factor. The average age of menopause is 51, but in some women it is late, and it can contribute to development of breast cancer. As we cannot take measures for non-modifiable factors, so we have breast screening. Breast screening is very important, and it can be life-saving. Breast screening uses an X-ray test called a mammogram to check the breast for signs of cancer. It can spot cancers that are too small to see or feel. आपका नेम आपके फैमिली डॉक्टर के रजिस्टर पे होता है. जैसे ही आपकी एज 50 इयर्स होती है, आपका फैमिली डॉक्टर आपको ब्रेस्ट स्क्रीनिंग ऑफर करता है. Breast screening is always offered. They cannot force you to go for breast screening. It's your choice. But breast screening is so important that getting screened regularly with mammography, it can detect the cancer when it is at a very initial stage and it has not spread to the other parts of the body. At this stage, treatment may also have a better chance of working when the breast cancer is found early. When breast cancer is found early, almost all women will survive for 5 years. However, if breast cancer is found later, only 2 out of 10 women will survive for 5 years. So this shows how important how important breast screening is and how it can save your life. Let's have a look at the Ontario Breast Screening Program. Ontario Breast Screening Program is a screening program designed to encourage women to get screened for breast cancer. The program is for anyone in the province who is eligible for breast cancer screening. The Ontario Breast Screening Program screens 2 different groups of women who are eligible for cancer screening in Ontario, those at average risk and those at high risk. Now, who are the women who are at average risk? All the women between the age of 50 to 74 who have no new breast cancer symptoms, have no personal history of breast cancer, have no current breast implants, have not had a mastectomy, have not had a screening mammogram within the last 11 months. So all these women are at average risk and they will be offered screening at the age of 50. And it is advised that you go for regular screening. It's not just once in a lifetime कि आप screening के लिए गए, आपने एक दफा screening कराई and just for your whole life. No, it doesn't work like that. You have to choose the regular screening, that is every 2 to 3 years, and be sure there is nothing wrong with your breast and everything is fine. Because जब कैंसर स्टेज 1 और स्टेज 2 पे होता है तो उसकी कोई अलामात भी जाहिर नहीं होती. मोस्ट ऑफ द केसेस में जब अलामात जाहिर होती हैं उस वक्त कैंसर स्टेज 3 और स्टेज 4 तक आ चुका होता है, जब उसको ट्रीट करना बहुत मुश्किल हो चुका है बिकॉज वो जिस्म के बाकी हिस्सों में फैल जाता है. सो इफ यू विल गो फॉर through screening, they will be able to detect cancer at a very early stage, that is stage 1 and stage 2. And at that stage, the probability of surviving for 5 years after diagnosis is about 88%. So you can imagine how life-saving this screening is for us. Now, moving on to the Ontario Breast Screening Program for high-risk women. Who are the women who are at high risk? They're the women who have the known gene mutation that increases their risk of breast cancer, and these genes are BRCA1 and BRCA2. Their first-degree relatives, parent, brother, sister, or child of they have gene mutation that increases their risk of breast cancer. They have already had genetic counseling and have chosen not to have genetic testing. They have been assessed by genetic clinic as having 25% or greater lifetime risk of breast cancer based on personal family history, have had radiation therapy to the chest to treat another cancer or condition before age 30 and at least 8 years ago. So all these women are at high risk and their screening will be started much earlier than the average risk group. The Ontario women ages 30 to 69 can get screened through the high-risk Ontario breast screening program if they have a referral from their doctor, a valid Ontario health insurance plan number, no acute breast symptoms. So they can be referred by their doctor and then they will go for high-risk breast cancer screening. Their screening will be more vigilant. It's not every 2 to 3 years. It will be every year with mammogram and with breast MRI. This kind of testing is based on scientific evidence and ensures that high-risk women receive the benefits of organized screening. So if आपकी positive family history है, आपको डॉक्टर ने आपको बताया है कि आपकी जेनेटिक्स ऐसा है कि आप में 25% ज्यादा रिस्क है कैंसर का, तो आप हाई रिस्क ग्रुप में आते हैं. उस केस में आपकी हिस्ट्री आपके डॉक्टर के पास होगी और आपका डॉक्टर आपको रेफर करेगा हाई रिस्क स्क्रीनिंग के लिए. उसके लिए आप जरूर चाहिए बिकॉज अनफॉर्चुनेटली जो वुमेन हाई रिस्क ग्रुप में आती हैं उनमें ब्रेस्ट कैंसर डेवलप करने का रिस्क बाकी एवरेज रिस्क वुमेन से काफी ज्यादा होता है. कैंसर की ट्रीटमेंट में सबसे इंपॉर्टेंट चीज ये है कि की तशखीस स्टेज 1 और स्टेज 2 पे हो, जब वो बाकी जिस्म के हिस्सों में ना फैला हो। उस स्टेज पे इसका कंप्लीट ट्रीटमेंट हो सकता है और सर्वाइवल के चांसेस 5 years से ज्यादा हैं। So screening is very important. When you reach the age of screening, go for screening and choose regular screening. Just to conclude today's discussion, I will say that's very important for all women to be breast aware. Know what is normal for you. And if you notice any abnormal change, consult your doctor immediately. And when you reach an appropriate age of screening, go for screening. Thank you.